Hello and welcome to the third season of the Education Podcast. I was going to say third episode, but it's not. Third season, Chris. We've done a lot of them.
We have.
Yes, welcome to the new series, the third series of the Education Podcast. And today we are going to be talking about quite a controversial subject, some people may say. Or is it, perhaps? Who knows? But we got some wonderful guests with us today. But before I introduce the guests, I wanted to talk a little bit about what's going to be coming up in the third series. We're going to be talking about ADHD, and we're going to be talking about the recent documentary into whether or not it's been unfairly and improperly diagnosed. And you might have seen it on the Panorama BBC documentary recently, and we're going to be talking about that in the upcoming episodes. And we're also going to be talking about, of course, what was issued this year in March was the SEN strategy, which is going to, I think, set the cat among the pigeons, Chris.
Quite possibly, Mike, as ever. They like to keep us busy in education, so yes, many exciting episodes ahead to talk about the developments. But today we're talking about a really interesting topic, something that I must say before in doing the research for this episode I didn't know anything about. But Mike, you had a case that dealt with this.
I did. It was some years ago, actually. It was funny. How was I introduced to this type of case? Some years ago, Chris, I had a call from a parent whose child was displaying bizarre behaviours. I mean, really bizarre. It was reported to me that it happened quite suddenly. And the child was quite a studious child, well behaved. Everyone spoke very, very well about the child at school, and the parents very warmly about their daughter. And it turned out that overnight almost, she was displaying really bizarre behaviours and was going into a sort of catatonic state, and was aggressive. Didn't want to go to school, irritable, at times behaving what can only be described as bizarre. And it turned out that she had a bacterial infection, which I'll tell you more about later, because we're going to introduce some wonderful guests who will explain it in a far better way than I can, because I was just dealing with the legal side of it. Because, of course, the legal side of it, when I learned about it, I realised the enormous implications it would have on what they needed to do and how the law could help them. And it was a real learning experience for me. And it was, I think, Chris, I've got to be honest with you, I think it was, I'm guessing, but it must be more than 10, 12 years ago. And it was, I'm not sure even then whether or not, I can't remember whether or not it was called it's given the title that it's been given now, which we will soon explore.
Yes. So would you like to introduce our guest, Mike?
I think we should. We have two guests. We have Vicky Burford, who is the founder of a national charity, I think called PANS PANDAS UK, but Vicky will, of course, tell us if that's any different. And, of course, we have Tina Coop, who works with her, who's a leading educational practitioner. And so I think that's what she's going to be talking about, the ramifications in the education world of it. So welcome to my two guests. Vicky, warm welcome to you. Vicky, we introduce you first. Vicky, you set up the charity PANS PANDAS back in 2018, I believe.
That's correct, yes, alongside a number of other parents, really, who had children with the conditions. And we couldn't believe there was no healthcare provision for these children who were extremely sick. And so we just decided that we had to do something about it, and hence the charity was born.
So what is the condition? What is PANS and what is PANDAS? Tell us.
Okay, so there are subsets. There are a set of conditions. I'll tell you what they stand for. We call them PANS and PANDAS, those acronyms. And the reason for that is that their names are extremely long. So PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. And PANDAS stands for Pediatric Autoimmune Neuropsychiatric Syndrome, a disorder associated with streptococcal infections. So you can understand we don't want to use those terms every time we talk about them. And they are very, very complex conditions. They're immune-mediated neuropsychiatric conditions, which means they're a misdirected immune response to an infectious trigger. So you talked about the person that you've supported previously. They had an infection, a bacterial infection, and then they developed this constellation of unusual, kind of seemingly unrelated symptoms out of the blue. So, for example, a child could develop chickenpox or scarlet fever or COVID-19. We see a lot of people presenting to us following COVID-19 infections. Most of the time, people will get better from those infections. But there are a cohort of children who will develop this constellation of seemingly unrelated symptoms. Usually the symptoms are very severe. Usually the onset is very abrupt. So you'll see a child who is perfectly, just living their best life, going to school, doing all the usual things that a 12-year-old might do. And then they'll get sick with a stomach bug or chickenpox or something. And then maybe 2 or 3 weeks later, overnight, suddenly they will change. They will become completely different people. They will develop symptoms that range from OCD type symptoms. They may stop eating. They may develop tics, both vocal tics and motor tics. They may develop anxiety, separation anxiety, rage, behavioral regression, educational regression. They may start wetting the bed. They may develop insomnia. I mean, there's a whole range of symptoms that can present with PANS or PANDAS. And what makes it even trickier is that the symptoms can change from child to child, and they can even change within the same child as the disease progresses. So it is a very complex condition. It's not easy to explain, and certainly in the time we've got here today, I couldn't go into detail. But if anybody was interested and they wanted more information, they can visit our website, which is panspandasuk.org. There's a list of sort of the diagnostic criteria and the symptoms that might present. So if someone's thinking, gosh, that sounds familiar, my child suddenly changed after they had this infection, and some of those symptoms sound familiar, I would urge them to go to the website and have a look. I think it's important to point out that the conditions can only be diagnosed by taking a detailed medical history. And you look at the onset of the conditions and the constellation of symptoms. There are no tests at the moment that can rule it in or out. And if anybody, if a medical professional does do tests, it's usually to rule out something else, because PANS and PANDAS are also a diagnosis of exclusion. So you have to rule out all other possible causes before you can give a diagnosis of PANS and PANDAS. So they are quite challenging to diagnose, and we are. One thing I do want to just add in, which I think is really quite important. One of the questions that I receive very frequently, both from parents and also from medical professionals, is the question of ASD. And because the diagnosis is a clinical diagnosis and a diagnosis of exclusion, very often a doctor will say, oh, well, the child has ASD, therefore it can't be PANS or PANDAS, because they will attribute the symptoms that they see in PANS and PANDAS to the ASD. And what I want to stress is that what we actually do see quite a high number of people with ASD who also have PANS and PANDAS. In the same way that with ASD, you can get any other kind of infection on top of ASD, you can also get PANS and PANDAS. And I had a conversation last year with Dr. Sue Swedo, who is the doctor in the States who actually named the conditions back in the 1980s. And she said the key thing with a child with ASD is the change in their presentation. So a parent of a child with ASD knows their child well. They understand what is, what a normal day looks like for that child. And the key message is the change in the child. So if that child has the everyday, they live their life this way, and then all of a sudden they wake up one morning and there's this huge range of new symptoms, or the way that they present with their ASD is so much worse than it used to be, then that needs to be investigated, and certainly not just assumed that everything is down to that. So yeah, I think that's just an important point to make.
No, very helpful and important point. So, as Mike alluded to in the introduction, and as you mentioned during your talking point there, Vicky, so is there a controversy about the condition? I mean, you mentioned that it was named as far back as the 80s, which is increasingly far away now. But for
you maybe.
Well, exactly. For a condition that has been, I suppose, discovered for some time, what is it that makes the condition considered to be controversial, or is it controversial?
Well, I would say no, it's not controversial at all. And I think it's really important to know, important to let your listeners know, that the conditions are officially recognised by the NHS. However, there is a great deal of misinformation and misunderstanding among the medical profession, and this is where the problem lies. So there are differences in opinion about treatment processes, and there is no current agreed pathway for these children. So it's really difficult because doctors are, in the main, they are using information that they might have heard about something, many years ago. There's no real training into these conditions, and it is difficult. But this is, of course, why we set the charity up, because we wanted to make a change. We wanted to ensure that all children, regardless of where they came from, how much money their parents have, were able to access a sort of equitable and efficient and effective healthcare. So some of the work that we're doing to address these sort of, I hate the word controversy, because there is no controversy around the condition itself. The controversy lies in how to treat the conditions. So we formed an all-party parliamentary group, and we're having meetings with NHS England at the moment, and we're hoping meetings with NHS Scotland and Wales and Northern Ireland will follow. But at the moment, it's just NHS England who are engaging with us. And with their support, we've actually developed a working group, and we have representatives now from all of the Royal Colleges. I say all of, the majority of the Royal Colleges, so Royal College of Paediatrics, Royal College of GPs, the Royal College of Psychiatry, also the British Paediatric Neurological Association and the British Paediatric Allergy, Immunology and Infectious Diseases group. That's a mouthful, isn't it? And the British Association of Social Workers. So lots of people really engaged and wanting to help develop a pathway for these kids. So we're working on identifying the right kind of treatment. So there are international guidelines, but there are no UK guidelines currently. So that's what we're working towards. And hopefully it won't be too long before we've actually got something that we can help our medical professionals to know what to do when these children sort of show up on their doorstep.
Well, Vicky, I'm sure that many viewers and listeners will want to ask, how is it that you got involved in this? Because, of course, you're working so hard and you seem to have so much information at your disposal now and in spreading awareness of the condition. So how is it that you got involved in the first place?
With personal experience, my son became very ill suddenly at the age of 12. He was a happy and healthy young lad. He had ASD, still has ASD. But he was a really happy, bright kid. He was doing really well in school. Life was good. And we went on holiday and he got sick. He developed an infection. We don't know what that infection was, but he was given antibiotics at the time by a doctor abroad. And the idea was that he would have the antibiotics would get him well enough to travel home, because he really was quite poorly with what looked like flu. But it wasn't flu, because obviously he was given antibiotics. Anyway, we got home and everything was fine, and he went back to school, and that was fine. And then one day he came downstairs and he said, "Mum, something's not right. I can hear voices." And I was like, "You what?" "What do you mean you can hear voices?" And I won't go into detail, but basically from that moment on, within the course of a week, my incredibly clever, happy, fun-loving, cheerful boy had he'd lost the ability to read and write. He was having very strange sort of seizure type activity. He developed some very strange OCD behaviors. He was not the son I recognized. He lost his sense of humor. He became very he was unable to cope with texture and sensation on his skin. He couldn't watch the TV because of the flashing lights. It was too much for him. He became very, very sick, and within throughout that week and then going on, we got no help from the NHS at all. We were investigated for one possible illness. When they decided it wasn't that illness, they literally washed their hands of us and said, yeah, there's nothing we can do. We don't know what it is. And my son was unable to go to school. He missed an entire year of school before we found a private doctor who was able to who treated him a little bit. He didn't get completely better, but he was better enough that he was able to go back to school for a bit. He didn't cope very well in school for that second year. And then we found a doctor, an NHS neurologist, who said, "I think your son may have something called PANS." And so he treated him with an antibiotic, a really simple kind of broad spectrum antibiotic. And I kid you not, within a few days of taking those antibiotics, all of my son's symptoms went away.
Wow.
He
So how long did all that last? I mean, from the moment
2 years.
2 years.
2 years before we saw the neurologist who gave him a diagnosis and the treatment. And if I hadn't seen it with my own eyes, there is no way I would have believed that this huge amount of symptoms that my son was presenting, that was ongoing, and all of the other doctors had kind of gone, yeah, it's his autism. They did blame it on his autism. And they said, oh, it must have been trauma because his grandmother died at sometime before he was ill. They came up with all sorts of weird and wonderful reasons for why my son had so completely changed, and his life was ruined for 2 years. Our lives were ruined for 2 years. We actually it had a much wider impact on our family and our business. We ran our own business. We no longer have that business. There's an awful lot of impact, really, really negative impact from having a child who is this sick. And when you are not, or when you, I mean, at one point, the pediatrician blamed me as a parent for being too emotional. And how could I not be emotional? My son was really, really sick, so when you have that blame put on you as well, it's a really, really difficult place to be.
Yeah, we'll come back onto that. I mean, in terms of what difficulties did you have in trying to relay your story, the horror story that you went through, to the educationalists, to the schools? Did you have a problem trying to explain to the psychologists or the school teams why?
We didn't. My son didn't go to school when he was sick. So that wasn't a problem for us,
Now, were you
because
threatened with any action for not sending your child to school, or?
no, we were fortunate. My son actually was given a scholarship to go to a private school because he was so bright. So it wasn't an issue for us. We did not face any of the difficulties that so many of our community face around school absence. So our school were very helpful in that respect. They said that the place will be waiting for him when he gets better. And when he did go back to school, they tried to put in as much as they possibly could to support him. But for me, that wasn't a problem. But you'll hear shortly from Tina about how it really is a problem for the majority of people.
And Vicky, just before we move on from your son's story, can you give us an update? How's he doing now?
He is living his best life, let me tell you. So we're really, really pleased. I think it's quite interesting because he was so very poorly, and he lost the ability to read and write, as I said to you. He's got a place at Cambridge University, so he'll be going there in September, and he just caught up from the years that he wasn't able to go to school.
And what's he going to be studying?
He's studying music.
Music. Oh, wow.
Yes.
Wow.
Yeah.
Well,
So
Fantastic. Well,
he'll be composing. He's going to be the next Andrew Lloyd Webber. Let me tell you.
I'm sure. I'm absolutely sure.
Send some videos of his music. It'd be great.
Oh yeah, definitely.
Yeah.
Oh, I can. Yeah, absolutely, I can. Yeah, I've got plenty of them.
Good.
Fantastic. Well,
So,
I think that's probably the right moment to start bringing in Tina.
just about to
Because
say.
I think, Chris, the point that's interesting about that is it's one thing for a parent to then battle with the NHS and the health services and say, look, get to the bottom of what's causing my child this, these symptoms. Can you imagine the complexity, the difficulty in conveying to a teacher after, look, this has happened overnight. I could just imagine how awful it was. I remember it in the case I was involved in. But cue in Tina, I think.
Indeed. So Tina, to give you a bit of your background, you're a teacher with over 20 years' experience in a variety of different settings. So I understand that your work with the charity focuses on those children, so it's like Vicky's son did, who have difficulties with their education. So you can tell us a bit more about how PANS affects those in terms of their education.
Thank you. So I think you brought in such a good point in that it's really difficult to convey to schools just what's happening. Schools often find themselves in a really difficult position, and that's because they've never heard of the conditions. They need to go and get medical support in some cases, but the support isn't out there. They need to access educational expertise, but that's not out there either. And these children really do present with a vast range of kind of bewildering symptoms. They seemingly are nothing to do with each other, these symptoms. And also it's totally unexpected. So nobody is expecting these changes in the child. And, often the family just doesn't know what's hit them. The school doesn't know what's hit them, really. So there's a whole sort of context around it. But some of the things, and I won't be able to cover them all, there's so many different ways that children can present. But just some of the key things is that you might see that a child who was previously really happy to come to school might now be intensely distressed at the school gate, leaving mum or dad. And the key thing is it's a change. It's like you're looking for these kind of multiple unexplained changes in the child that are not related to family life or anything else, that you kind of know what's going on. You might find that a child develops really disabling levels of anxiety in the classroom. They might need to leave several times during a lesson or become overwhelmed when they're asked, to do a task. Often children get really reliant on adult support. Sometimes children with PANS or PANDAS can be aggressive. And this can be obviously really challenging for schools. It's really challenging for families who often report that, before the onset of this, their child was absolutely fine. It's really easy for schools to kind of misunderstand the symptoms as a poor behavior, as a neurodevelopmental condition, as attachment disorders. We've got lots of parents where it's suggested then, that it might be helpful for them to go on a parenting course. And then you've got these unusual learning and cognition changes. So typically these kind of learning difficulties would be more stable, would be more chronic. You'd have a kind of developmental pattern of signs emerging, but that's not the case in these children. You know, we've got lots of parents who say, oh, my child was great, a bit like Vicky, exceeding expectations. And then suddenly this child's got all of these different problems.
Tina, for teachers, this must be dramatic too. I mean, I know you give training to teachers and you're delivering resources and so on. What are the key things that you think a teacher might need to be alert to when dealing with a child who's transformed like that over the last, few days?
So I think, firstly, it's really helpful if teachers are aware of the diagnostic criteria, because then they can know that such a range of seemingly disparate symptoms can be linked to one condition. It's really helpful if they understand the unusual characteristics of PANS and PANDAS, for example, that children can develop these acute onset learning difficulties as opposed to developmental learning difficulties. And it's really helpful if teachers can then speak to families and parents to check on what they may have observed from home. And lots of children with PANS and PANDAS can mask their difficulties just the same as in other conditions. And this is causing real issues at the moment with parents reporting one kind of presentation and schools reporting a different kind of presentation. But it's actually really, really common in these conditions. And then what teachers can do that would help parents immensely is they can take professional observations of the child. But what's important is to capture the breadth of changes, because it's in these different areas: physical changes, social and emotional changes. You might have changes in interaction and communication. And it's about capturing all of those impacts on the child and giving equal weighting to those impacts, so that when those parents go along to a general practitioner, they're taking the whole evidence along with them rather than just the most dramatic symptoms, because they're often psychiatric in these conditions. And things like changes in working memory, executive functioning, they can tend to get lost because they're less dramatic, or they might not be picked out. So those are some of the things.
That's really interesting, Tina. And of course, when Mike and I hear things such as functioning, executive functioning impacted, working memory, obviously, and as you say, the wider, almost psychiatric presentation of the child in the learning environment, we think of, those are the types of, symptoms or features that we'd see in children who, with other disabilities and other conditions, who may require support through an EHCP. So in your experience, working with pupils with PANS, do they often get EHCPs? Is that a route that they often pursue?
So that's a whole area in itself that you've touched on. And, this is a huge area, and there's so many kind of current issues that arise time and time again. So children with PANS and PANDAS do often need EHCPs because they're sudden onset. The way the code of practice works with assess and review sometimes doesn't work with these children because it's so severe and abrupt. And that you kind of need to go straight to getting in, more extensive support. There's low levels of awareness of PANS and PANDAS, and that's across healthcare, social work professionals, and, the EPs, all of whom you're going to need to input into your EHCP. So they're not going to have heard of the conditions to start with. Secondly, they're then put in this really difficult position. They're assessing children's needs that may not be consistent with the training and other learning difficulties. And also they haven't got any access to any further training or guidance. So if a parent says, my child's got a diagnosis of this, there's nowhere to go. There's nowhere to access any expertise. And although we know that the EHCP is education rather than diagnosis led, you'll know this, but parents and carers can find themselves in a really difficult position of advocating for their child while they haven't got a diagnosis or treatment for the, children. And we know that some children with these conditions receive incorrect, or they get multiple diagnoses. They're relapsing and remitting the condition, so they go up and down and the symptoms go up and down. So although any assessment is a snapshot, in PANS and PANDAS it really is, because you're going to get very different outcomes if you're assessing a child while they're acutely unwell with this whole constellation of neuropsychiatric symptoms than you are, if they're during a more stable period. And we've certainly got cases where children are placed in permanent educational settings based on outcomes that have been taken when a child's in a severe flare, because there hasn't been the understanding that this is a relapsing and remitting conditions. And also because there's such a disparate wide range of needs, then often all of those needs are not identified in the EHCP. So that's just some of the key issues that are going on, but there's many more.
Thank you, Tina. That's, a fascinating and complex challenge, Mike. I think you'll agree.
I can see how a local authority might react to a case in which you're asking for an EHCP when you have a condition called PANS PANDAS. In Vicky's case, for example, it was a case of giving the right antibiotics, and we saw quite a sudden improvement, and so I can imagine that a local authority argument might very well be, well, get the medical situation resolved, and we'll see what's the point of having a long assessment that will take us many weeks with a plan that's supposed to last for many years. I can see that, but of course Vicky's case is not like everybody else's cases. No, the cases are different. I think that's what you're saying, Tina, isn't it? That there's some children with this condition, it might be the symptoms might last for many, many years.
Yeah, exactly. And there's a different course in the condition for children, and there's a lot we don't know. So we know that some children, they have flares and they'll go back to their baseline and they'll get better. We know that other children have several flares and then they're slowly moving further away from their baseline. We know that others still develop a chronic course, and we know that other children develop a chronic progressive course. And there's so much variation, and there can be such a large amount of variation within the same child. They can be presenting really severely, in which case they'll need extensive accommodations, or they can, the other extreme is they don't require any help and support. And it's that kind of pattern of this acute onset of difficulties and this relapsing and remitting condition within the current medical context that's causing so many difficulties for our families and our children. I've just got a couple of things that parents have sort of said. Is that the LA don't accept a diagnosis of PANS or PANDAS. That's one. I can't get an EHCP that accurately reflects my child's needs because no one understands him. And my child was placed in a specialised provision based on assessment during a flare. Now that she's recovered, everybody's wondering what she's doing there. So those are just a few key things that parents have told us.
Oh, I can imagine that. That's an awful thing. I mean, you're in a new placement. You're now improved, and you're able to return to mainstream education, say, completely bewildered as to why you're there. I mean, I've dealt with cases like that, Chris.
Oh no, definitely. I think we've seen manifestations across different conditions, but I think with PANS, it's one of its key features, one of its unique features, is the acute and sudden onset of these features, which means it's so unusual, but as you say, perhaps could potentially, if assessed during a flare like with that young lady, lead them into a situation where, as you say, they're in the wrong setting for them during periods of recovery. Although, of course, because of the risk of relapse, how long that will last can also change. So it's I suppose it is not a controversial condition in that it exists. It's well regarded. It's on the NHS Diagnostics. It's been researched for many years. Stanford have an institute as well that have been researching it for more than a decade. So it is something where the controversy is more that the case is so complex and difficult to understand and recognise because of the lack of a kind of test of diagnosis. I think, Vicky, you said at the very beginning. And then, of course, it's a diagnosis of exclusion, which means that it's hard enough, as we know from our cases, to get diagnosis of ASD, diagnosis of mental health difficulties, all other types of conditions, all have long waiting lists. And yet, in a case with PANS, you're not just waiting for one diagnostic assessment. In reality, you're waiting for all of them to conclude possibly before the conclusion is reached that actually yes, it's not those conditions, it's PANS. It's a very complex situation, and I think, Vicky, that leads us neatly back to a point that you raised earlier, where with regard to the paediatrician, you were parent blamed, where the claim was that you were too emotional, and obviously it was perhaps you that was misreading your own son's signs. And this leads me on to your guide that the charity has recently released about PANS, PANDAS and FII, which as viewers will be aware, we've done a programme about before. Can you tell us a bit about that and why that guide was so important to release?
Yeah, well, actually, I'd like to pass on to Tina for that, because I think Tina's got, particularly around education and why.
Oh, excellent.
Well, Vicky, were you accused of anything by the local authority or by anyone?
No, I wasn't. That accusation from the paediatrician didn't go any further than a comment in a letter. Obviously, she said it to me in person in the meeting, but no, it didn't go any further. I was I consider myself extremely fortunate in the way that things worked out for me and my son, because we found a doctor who was able to treat him. He responded well to the treatment, and he hasn't relapsed. So we're in a really, really fortunate place, but that is very unusual. Actually, I've discovered that my situation is extremely unusual, and actually, what seems to happen is that patients will, even if they find a doctor who can treat the child, the treatment given is usually very short periods of treatment, and then when the treatment stops, the symptoms come back, and because of the misunderstandings around the way that treatment works, many doctors will say, well, you've had your treatment for it and it hasn't worked, so it can't be that.
So I'll bring in Tina, I think, again, because as Vicky suggested, Tina, I mean, obviously, for schools, it's often the case that they are the first point, really, that's going to lead to a child protection referral. So they often will send their concerns off to the local authority. I find it really concerning that from what the charity is saying is that you've had to produce a guide to try and help parents and indeed schools to actually look at this more carefully before you speed off in that direction. Tell us a bit about the guide.
I think you raise a really interesting, you raise an interesting point. We know that disproportionate numbers of families supporting children with PANS and PANDAS are accused of safeguarding or FII concerns. And we know that many of these concerns are raised by schools. And when we look at some of these context-specific factors, it's really easy to see why that's happening. So there's firstly, almost all children with PANS or PANDAS will have some warning signs of safeguarding, because these are the same as their symptoms. For example, being tearful, depressed, low self-esteem, deterioration in school performance. Most children will have some of these, some children will have all of these. So that's the first thing. The second thing is that often children become socially isolated when they've got PANS or PANDAS, so that can be another vulnerability factor. Siblings of families usually also begin to struggle a lot. As I mentioned before, no one could see this coming. It affects, the ripple effect affects the whole family. So siblings are more likely to develop the condition itself. There's been shown to be a genetic link, but there's also the secondary impact on living with a sibling from whom this is happening. Parents can't get a diagnosis usually on the NHS. It's nowhere near as straightforward as going along to your GP with your child with your symptoms and getting a diagnosis. So many parents go from doctor to doctor to try and get help for their child. So that's another vulnerability factor. Often schools then say, oh, well, parents are focused on medical investigations and they're not following the guidance. Often children are offered psychotropic medications as the first line of medication, and sometimes parents are unwilling to take these if they feel it's PANS or PANDAS because they'd rather try a different approach. That can be used against parents as well. Or there's also masking. So we know that masking is really common in PANS or PANDAS. So school and parents are reporting a very different picture of severity of need. That's another key factor. And yeah, so those are some of the vulnerability factors of our families. And that's
Is this guidance? Sorry, Tina. Is this guidance for parents, or is it for schools, or both?
So it's aimed at professionals, so social care professionals, health professionals, and education professionals. So there's a section in each part of it to look at these sort of context-specific vulnerability factors that are relevant for that professional body.
Chris, it seems to me that social workers are the first people that we want to try and inform.
Oh, absolutely.
And hopefully there are many. We had social work practitioners, expert social work practitioners, in the FII presentation that we did. And that was pretty interesting and well received, wasn't it? So
no, absolutely. It's great work that you're doing as a charity to raise awareness for a little known and even less understood condition. And guides like this are obviously going to help, as you say, take away that ignorance, or dispel misinformation. I know, Vicky, you said that's a key issue around the condition and how it manifests and how best to approach. So I mean, I'd like to end, if I can, on what I hope is a positive note. So I suppose, Vicky, we'll come back to you. And thank you, Tina, so much for your wonderful contribution. What do you see as the future for the understanding and treatment of PANS and PANDAS in the UK? Is there a cause for optimism?
I believe very strongly that there is a cause for optimism. I think that the work we're doing with the Royal Colleges is going to be key. And I say the Royal Colleges, obviously there are other organisations involved, including the British Association of Social Workers. And we have a DCO representing there as well. And that's the DCO sits very firmly between health and education. So there is that education element to the work that we're doing. And I think because we have the support of NHS England, once a consensus is reached, and that's what we're working on now, then we will be able to put pathways in place, which means that when a patient presents to their GP with this constellation of symptoms, or even with just one symptom, because what we find as well is that your child suddenly presents with a range of weird symptoms that you can't put your finger on, but maybe one of them is more severe than the others or more worrisome. So that's the symptom that you'll go to your GP with. You won't necessarily talk about the other symptoms because you're worried about this one. And so, for example, my son, he couldn't read and write. That was a real problem for me. So that's what I focused on. And I kind of ignored the fact that he had OCD and some other strange behaviours. So what we want is the GPs to be able to see this sudden change, this sudden onset of a strange symptom, and then know what questions to ask. And then be able to kind of think, well, perhaps this is this, and perhaps we can trial this kind of medication, because the earlier these conditions are identified and treated, the better the outcomes as well. So I do see that happening, and I think within a couple of years the landscape will be very different. So yeah, I do believe that there is real optimism, real cause for optimism. Yes.
Excellent.
Well, that's at least an encouraging bit of information.
Absolutely. I mean, there's nothing better to know that, as you say, that things will be getting better. And
but I can see the enormous problem that schools and local authority officers, parents, everyone really, will face. I mean, people who are, I wouldn't say the word ignorant, but people who are less informed are those who put the label of controversy on this.
Yes, no, absolutely.
It's simply just not enough information out there. And one hopes that podcasts like this will go some way to help inform the general population that before you leap to conclusions about, why a child is presenting in this particular way, you think and pause and say, well, actually, there are conditions such as PANS PANDAS that might provide the explanation. I mean, for me, I'd like to thank both Vicky for your contributions today, and thank you, Tina, for both of you. I mean, excellent information. Really, I'm really grateful to you. Chris, it's been wonderful.
No, it's been wonderful. Thank you both. And for those watching at home who'd like to learn more, we will be putting links in the description, both to the PANS Pandas website and various guides, but also to other resources that deal with the condition as well. So you yourselves can learn more if you need to.
And on that note, I'd like to wrap it all up. Thanks to my guests, and of course, thank you, Chris, also for joining me today.
Thanks for having me.
And I look forward to seeing you again in the next episode, where we will be tackling, I believe, the controversy of the Panorama report and also the SEN strategy. So thank you for watching, and thank you once again. Bye-bye.